Good morning, everyone. This is Jessica Dalzell from Ohio EPA. We will be starting our webinar in approximately 1 minute. We still have some folks logging on. Good morning, everyone, and welcome to Ohio EPA's 2023 Sustainability Conference. My name is Jessica Dalzell, and I am with the Recycling and Sustainability Unit at Ohio EPA, and I'm going to be moderating today's session, Green Healthcare, Healing Patients and the Planet. Today is our last day of our 3-day 2023 Sustainability Conference, but we do have 4 great sessions lined up for today, and you can still register for today's later sessions on our Ohio EPA conference webpage. Before we get started, I'd like to go over a few items to help you participate in today's session. On this slide, you see an example screenshot of your attendee interface. You should see something that looks like this on your computer desktop. It should be on the right-hand side of your screen. If you are having sound issues or if the slides stop advancing, please try refreshing your browser. If that does not work, try logging off and logging back in. If you continue to have issues, whether that be sound or your slides not advancing, please let us know in the question pane and one of our behind the scenes team members will try to assist you. Please also feel free to submit questions to the presenters at any point during today's session by clicking on the question mark icon and typing them into the questions pane. We will be sharing your questions with Kevin, who will be asking them to our panelists later in today's session. If we don't answer your question, we will provide them to the presenters to follow up via email after the session. You can click on the document icon on your attendee interface to view a PDF file of the PowerPoint slides used for today's presentation. Additionally, this session is being recorded and you will receive a link to the recording in a follow-up email. Now, I would like to go ahead and introduce our presenters today. Kevin Zacharias will be leading our fireside chat today. Kevin serves as the Ohio Hospital Association's Director for the Energy and Sustainability Program, which is the only state hospital association-run energy and sustainability program in the United States. Throughout his professional career, he has focused on a holistic approach to sustainability consulting, looking at energy, waste management, air quality, water conservation, and environmental justice. Also on our panel today, we have Allegra Wiesler. Allegra is a sustainability advisor at Ohio Health with over 10 years of experience in the environmental field. She established and continues to lead sustainability efforts covering Ohio Health's 15 hospitals and 60+ outpatient locations throughout 50 counties in Ohio. Allegra tackles energy, waste reduction, green transportation, sustainability procurement, and healthy buildings projects. Next up, we have Lauren Cook. Lauren is a sustainability program manager at the Ohio State University Wexner Medical Center. She brings over 12 years of healthcare and sustainability experience. Lauren participates in national sustainability industry groups, including the U.S. Healthcare Climate Council, the Healthcare Plastics Recycling Council, the American Society of Healthcare Engineers Sustainability Task Force as well. We will also hear from Noah Dunlap. Noah is the Vice President of Insights, Innovation, and Project Management for Advantis Health Partners, which is a subsidiary of Mercy Health. In this role, Noah is responsible for advanced analytics, project management, investment, workforce development, and the Environmental, Social, and Governance program. Noah has more than a decade worth of experience in healthcare supply chain operations. Now I will go ahead and turn it over to Kevin, who's going to give a brief overview of the Ohio Hospital Association, and then we'll start asking our panelists some questions.
Jessica, thank you so much, and good morning, everyone. Thank you again for joining us today. As Jessica mentioned, my name is Kevin Zacharias, and I am the Director of the Energy and Sustainability Program for the Ohio Hospital Association. Today, I'm joined by 3 OHA members who truly are doing amazing work in the field. I just want to say thank you again for joining us, and thank you again to Ohio EPA for inviting us to participate. It is just an honor to be here today with this amazing panel we have for you on sustainability in healthcare. So to start, I'm going to provide an overview of OHA's Energy and Sustainability Program, and then we're going to jump right into a fireside chat with our panel. So a little bit about the Ohio Hospital Association. We were the first state hospital association in the nation, established in 1915. Today, we currently represent all 248 hospitals and 15 health systems throughout the state. Our mission is to collaborate with member hospitals and health systems to ensure a healthy Ohio. This mission is what really led us to creating an energy and sustainability program because truthfully, the two go hand in hand. We are currently the only state hospital association in the US with an energy and sustainability program, like Jessica mentioned. Hopefully there are more that are going to come, but we still continue to be the only ones out there. Our program has really focused on providing our membership the resources needed to advance their own energy and sustainability goals, but also connecting those leaders throughout the state. We do this through the creation of peer network groups, but also providing educational events and resources. In addition, we offer an energy procurement program, and then we advocate at various levels of government on behalf of our hospitals too. To achieve this, our program has implemented several components. I'm not going to be able to cover all of these today, but I did want to highlight a few. So we currently offer an Energy Star benchmarking and certification program where we gather our hospital's utility data, we enter that into Energy Star's Portfolio Manager. And for those of you who aren't aware of what Portfolio Manager is, it's essentially a utility database that once you enter in that data, it helps to calculate a score based of 0 to 100, which really kind of judges how your facility is doing against your peers out there. So our team then provides a roadmap to our members by educating them on their Energy Star score and helping them identify areas of improvement. So to do this, we have a team of contracted engineers and energy and sustainability specialists. The team is through a company called ClearResult. So we have that contracted out, and ClearResult is the largest provider of energy efficiency, energy transition, and decarbonization solutions in North America. In addition to our Energy Star benchmarking and certification program, they also help us administer our energy procurement program as well. So throughout the years, our Energy Star benchmarking certification program has had a lot of success. In 2023, we were awarded the Energy Star Partner of the Year Award for Sustained Excellence. And this is the third straight year of receiving this particular award. So, it's a great honor to receive that, but the true success goes to our membership who led the country once again with 19 Energy Star certified hospitals last year. This year in 2023, we're hoping for even more. We have that projected, but we will stay tuned to see how things go by the end of the year. A few other resources that I wanted to highlight. One is our monthly newsletter that we started last year. This is called Sustainability in Scrubs, and it is published on the last Wednesday of the month. And it features a variety of resources for members to take advantage of, program updates, environmental advocacy updates, and then we also have a feature called Green Thumb of the Month. And this highlights one or multiple of our OHA member hospitals and health systems, highlighting something that they're doing in the energy and sustainability space, highlighting case studies, those sorts of things. And then finally, I wanted to highlight this formal peer network group called our Environmental Leadership Council. This is a formal OHA committee that meets on a quarterly basis. It is led by our current chair, John Utek from Cleveland Clinic, and Chair-elect Terry Scannell from Ohio Health. We currently have 20 members representing our overall OHA membership, including all 3 of our panelists today. This group provides the OHA Energy and Sustainability Program guidance really in the services we offer to membership. So last year, we developed basically our first 3-year strategic plan, which this is what it looks like here. And the strategic plan was developed with kind of these 3 organizational priorities in mind, which are education, environmental advocacy, and membership. Within each of those priorities, you're going to see a goal statement and then our supporting objectives to achieve each of those priorities. This is how we envision the next, year and a half to go, and then, we keep evaluating what is needed in the future. But these are just some of the things that we are tackling here at the Ohio Hospital Association within our energy and sustainability program. Now, I've said this before and will continue to say this. We do this all for our membership because they have shown such a passion for sustainability efforts at their facilities. Their success is truly how we measure our success, and I'm just honored to be joined today by these 3 amazing individuals that we have on today's panel. So I guess with that, Jessica, I'm going to turn it over to you before jumping into our fireside chat.
Thanks so much, Kevin, for that great overview of Ohio Hospital Association. We are going to now begin our fireside style chat to answer your audience questions. Kevin will be facilitating that. And as a reminder, you can submit your questions through the questions pane at any time. All right, Kevin, take it away.
Awesome. Well, Jessica, thank you again. So today I am joined by, like Jessica mentioned, Allegra Weisler, Lauren Cook, and Noah Dunlap. So we are going to open it up with just hopefully a softball question, and we'll kind of go from there. So what does greening healthcare mean to you and your organization? And maybe what are some of the key elements or goals of your organization's climate strategy or action plan? And to start, I think, Lauren, I'm going to turn it over to you to start.
Yeah, well, good morning, everyone. We're so happy that you could join us, and we're excited to talk about this because we are passionate about it. But when I think about what does greening healthcare mean to me, I think it means delivering patient care that's truly aligned with the physician Hippocratic oath. So first, do no harm. And the message that I try and bring our internal stakeholders and leadership is really what we're talking about is health in all operations and bringing sustainability to every corner of the organization. As we think about the goals and the strategy and the action plan to get us there, we're a little unique as an academic medical center. So for us, the university really drives those goals and at least some of that strategy. So OSU is working towards a carbon neutral goal by 2050, a zero waste goal, energy and water reduction, purchasing environmentally preferable products, even a ecosystem services goal. So one of the requirements we have for new construction is that it considers the impact to the ecosystem that it's being built in. So if we take a green space and put a building and parking lot, how do we put back some of the ecosystem services that we removed? But I think, as we consider how do we take this strategy across our organization, I think it has to be bigger than a policy. It's more than just doing the work. For us particularly, it's about embracing our mission as a teaching organization. So we also, as we think about greening healthcare, we have to help future clinicians understand the importance of climate change and the impact it's going to have to patients. It's also about teaching employees how they can be more sustainable at work, but also at home. So this shows up in a couple ways. So one is an exciting new position that we created last year. It's just a portion of her role, but she does it fabulously. So she's the Director of Health Professions Sustainability Education, and she's really helping lead the effort to weave sustainability into education and think about for health sciences curriculum, how do we teach future clinicians about these impacts? We also have a 900 plus green team where we do monthly sustainability webinars, where we offer and promote our free composting at home programs. We give them a free compost bucket that they can take home with them, but then also have compost locations they can drop off across campus. We do some tree saplings and plant giveaway around Earth Day. So just a couple of ways of how we bring that kind of green healthcare space into work, but into home. But finally, we have to share our learnings with other hospitals. And I think that's the importance of, the three of us and the other health systems getting together through the Ohio Hospital Association Environmental Leadership Council, or, Allegra and I sit on a Central Ohio group related to energy efficiency. And nationally, we are part of the Healthcare Climate Council. So I think it's not enough for one hospital to be doing the work. We all have to be doing the work, and we have to have our employees taking it with us and our future students taking it where they go. So I think that's, just kind of summing up that question. It's how do we weave it and share it into every corner and every space that we go to.
I'm gonna piggyback on what Lauren said. She basically said everything, so copy paste what Lauren said for Ohio Health. But we all work very closely together to do this work, as Lauren said. So we're all nonprofit healthcare systems, and for Ohio Health, that means we're very mission driven. So our mission at Ohio Health is to improve the health of those we serve. So we really, everything we do, it has to make sure that we are aligned with our mission and our values. And one of those values is around stewardship, and that's usually where we try to get sustainability to align. Is, how are we being a steward of our resources for our community? And to Lauren's point about do no harm. For us, every single project we do around sustainability has a very clear communication and connection to human health. So why are we doing the work? Our physicians and clinicians, they do their everyday job because they want to improve the health of those we serve. Even the people in our boiler rooms that are there sitting and watching the boilers are not at all interacting with patients, always tell us that they understand that at the end of that boiler is a patient. And so everything is surrounding our patient care. And that's really how we start communicating the work around sustainability and how we at Ohio Health think about it. It's kind of that beyond the healthcare walls is how the healthcare industry is starting to think about kind of a proactive, preventative thought process around how do we care for our communities. So what Ohio Health has done to kind of reflect the priorities that we had internally around sustainability was sign on to the Health and Human Services Climate Pledge. So basically, Ohio Health has committed to reducing our greenhouse gases by 50% by 2030, and then hitting net zero emissions by 2050. So that's like around the corner. And to Lauren's point, we can't do it by ourselves. Healthcare emissions across the country account for 10% of our entire country's emissions. That's healthcare industry in itself. That's not us three. But altogether, we do emit a lot of emissions. That makes sense because we are a very energy intensive industry. We run 24/7, and we have a very global supply chain. So how do we as an industry work together to reduce our emissions? It's becoming very much so a priority because of that health piece. For us, because we signed on to that public facing Health and Human Services climate goal, we have at the very top level, our CEO has signed on to that goal. We have board of director level goals in that space. I report up through our C-suite, And we have committees of C-suite leaders that are in place to help us achieve this goal. So it's very much so integrated into our leadership, which I think is how you make this work successful at a healthcare or any kind of organization. But we do have help internally. It used to just be me. We've expanded, like Lauren has, to have more people on board. So we do have full-time people tackling sustainable procurement. We have someone tackling sustainability and a larger like stewardship agenda to help us achieve, you know, the integration with diversity and inclusion and governance, all of this work together as a larger, you know, mission-driven initiative. And we're leaning on our clinicians to do a lot of this work as well. So some of our nurses are some of the most engaged groups of people we have internally. And it's definitely a community-driven initiative, but it's something from a healthcare perspective makes sense for healthcare to be really investing in. Noah, do you want to add in?
Yeah, well, I'll certainly echo Kevin's sentiments at the start. This is a wonderful panel. Certainly love just hearing what Kevin, Allegra, and Lauren have shared. I would have registered for this if I wasn't on the panel for sure, just to hear all the wonderful thoughts. Our organization is a Catholic ministry, and so as we think about sustainability, we think about answering the call from Pope Francis in a document called Laudato Si by embodying what we call integral ecology. So in a sense, everything we say and do around this space is connected. And then at the core of this call is kind of right relationships with other people, plants, and animals, and with the earth and our environment. And importantly, of course, with God. So we believe in a wellness of mind, bodies, and spirit, and that this strengthens the relationship between humans and the natural world, and that in the eyes of God, everything's connected. So we demonstrate this in our commitment to strengthening these connections through our efforts in sustainability. And of course, we acknowledge that the impact of our actions on God's creation and with these right relationships need to be positive, right? So to Allegra's point, stewardship is an important part of our identity, you know, and as we think about some of our core values, we contemplate justice, and we believe that really true justice includes action to mitigate negative impacts on the environment, which of course affect, and too often is the case, people who are poor and underserved disproportionately. So as we think back to our mission statement, it's to extend the healing ministry of Jesus, but especially to the poor and underserved. And so efforts in sustainability, knowing that often they disproportionately affect those that are poor and underserved, we want to make sure that we have efforts here as an extension of our mission. So we intentionally build integral ecology into our planning and operations across all levels of our organization. Similar to what was shared before by Lauren, we have a system level green team. Also hundreds of people participate in that. It meets on a quarterly basis across lots of different disciplines within our health system. And each of our markets as well have green teams that coordinate in connection with that system level group. We do strategic planning at both the system level and within the markets. So those green teams collaborate throughout the year to decide on what our focus will be in kind of operationalizing our aspirations here to care for our common home. So as we do, we get excited, we build momentum, and we share out what we're doing through various external settings like this one to encourage further collaboration. There's lots of possibilities, as Allegra shared, for coordination of efforts between health systems, and collaboration to share best practices as we're doing today. So very thankful to the EPA and for all the different organizations participating in OHA's ELC. Certainly have learned a lot through all these different settings to help us in our organization as we try to lift where we stand. Thanks, Kevin.
Awesome. Well, thank you all for kind of kicking off the panel. I know on the OHA side of things, since coming on board, previous to that, our program was really focused on energy. And after just hearing, I mean, obviously you can all hear the need for channeling not only energy efficiency, but looking at sustainability on a holistic level as well. That's what led us to really about 2 years ago expanding our program to focus on an energy and sustainability program instead of just the energy program. So, we are a member-based organization, and we truly take that to heart when we listen to our membership, and we want to provide the resources that they need to be successful. So I guess diving a little bit deeper, I think we'll go with the same kind of order again. But so Lauren, this one will be for you to kind of kick things off again. What are some of the projects that you are currently working at your facility? Or facilities, since you are all part of health systems.
Yeah, we are primarily one large academic medical center, but we also have a community hospital and about 100 other locations across Central Ohio. So I shared a link that I hope is going to be shared with the participants just so you can learn more. I'm just going to highlight a few projects. Part of the reason we went with this format is because a lot of us are doing very similar work. So I think you'll hear from all of us that waste is a huge opportunity in healthcare. And so we're all working on recycling or waste reduction. I think maybe two things that I'll highlight there's just that we're working on clinical plastics recycling for the first time. We started a pilot about 2 years, and we're continuing to scale that up. So kind of the softer plastics that you can't send through your typical commingled system. And we have a lot of that, I think, as many healthcare facilities will relate to. We also have been for 4 years collecting blue wrap. So this is the blue sterilization wrap that goes around instruments to make sure that they're maintained sterility as they're being transported. So it's clean material. And we are actually buying that back through a 90% recycled bedpan. Other things that you're going to hear that are commonalities is we're all working on energy reduction, thanks to, in big part, from OHA and our Central Ohio group. But one of the new positions we just hired is a senior energy engineer, and I think he's just really going to take this to the next level. Again, our unique position as a university is allowing us to leverage a campus-wide partnership with an organization called ENGIE, and they have a performance-based contract where they're working on campus to reduce our energy use intensity by 25% in a 10-year period. For our offsite locations, though, we're really watching what they've been able to do with energy conservation measures and then taking those to our community hospital and to some of those owned locations in our suburban areas that we've started to open up in that outreach ambulatory strategy. So other things that I'll mention, again, thanks to our campus partnership, we do have some renewable electricity gains. So for all of our electricity, this is not all energy, so important clarification. We do have about 30% renewable electricity, and that is primarily through a wind farm that was worked on about 10 years ago, and then renewable energy credits. We do not have a tremendous amount of on-site renewable power that we have yet, but that is something that we're looking to expand over the next 10 years. Another thing that I think you'll hear from all of us is anesthesia gases. Who knew that these are greenhouse gas emissions? And in particular, there's one that is both the most expensive and the most potent of greenhouse gas emissions. It's called desflurane. So for the last 6 years, we've been working on reducing the use of that and switching to a clinically equivalent alternative. And that has made some great gains. But in the last year, we had a really passionate anesthesiologist who's stepped up the game. Allegra talked about passionate nurses. I think a passionate clinician can make all the difference. And I love to call this the Dr. Rahman effect. So we were 50% down from all of our anesthesia emissions in the last year. Her work to really hammer home reducing that and then moving to low flow anesthesia has taken us to nearly 80% down. The other study that we're doing is around waste anesthesia gases, collecting what's remaining. So we'll be excited to share that as we get those results. So I see I'm a little over on my time. The last thing I just want to mention is, I was really moved by what Noah said around justice and how we bring this, and Allegra mentioned how we bring this outside of our four walls, and we're just starting to scratch that surface. So I'm excited to hear what you all are doing, but we have a Healthy Communities Center opening up in late winter next year. And so we're thinking about, how do we offer compost drop-offs for the community, maybe extending our employee treat giveaway to them, things like that. But trying to figure out how do we bring this sustainability and health all operations out into our community. So I'll stop there and pass it over to Allegra to hear what Ohio Health is up.
Yeah, thanks, Lauren. We're doing a lot of the same things across the system that a lot of other healthcare systems are doing. That's again because we all work together. So if a new greenhouse gas emission, for example, is identified, such as anesthetic gas was years ago, or we're learning about the greenhouse gas impact from pharmaceuticals and inhalers specifically. So as those newer discoveries are made, you'll start to see all of the hospitals start to figure out how to reduce their own emissions from that space. So there is a lot of overlap that's happening, but it's also good because again, our emissions are everyone's emissions and vice versa. So we're also, so sustainability is a lot. And in a healthcare space, there's a lot of priorities going on. We just got out of COVID. We're in a staffing crisis. So there's a lot happening in the healthcare space. But I actually think it's coming out of COVID, given sustainability, kind of this reinvigoration, because after seeing the supply chain across the world impacted by COVID, we saw a lot of this kind of burning platform need for resiliency in this space, especially with wildfires happening, infecting our air quality here. We're trying to understand at the health systems what's the patient impact hitting our emergency departments, hitting primary care facilities, coming out of things like wildfire and air pollution. So there's a lot of learnings happening. And I think, we're in Ohio, so we see very different climate impacts, but we do see climate impacts. So we are very actively working on trying to understand those. But so some of the projects we're doing in the air quality space are definitely around pushing for electrification for our vehicles. So Ohio Health has installed, I think it's like almost over 70, I think right now, electric vehicle charging stations across our system. And Ohio Health covers 50 counties in Ohio. So we're one of the largest, I think the largest healthcare system in Ohio. So we have a large footprint, which means we are moving goods around a large portion of Ohio. And we understand, again, the direct impact that environmental issues have on human health. And so the great example is electrifying our vehicles to have zero tailpipe emissions. So in addition to kind of investing in the infrastructure needed for electric vehicle charging stations, which we do have an internal policy to have kind of that 50-50 approach to if we install associate or workplace facing charging infrastructure, we also ensuring that we are installing the same amount for public facing. And that's just ensuring that charging equal access to charging approach. We're also, public facing. So we're having patients and visitors accessing hospitals when they weren't expecting to possibly access these hospitals. And so we want to make sure that they have the charging infrastructure there if needed. But we also have internal policies around procurement of vehicles. So every single time a new vehicle is needed to be procured internally throughout our entire system, then we have to go through a feasibility assessment to see if that vehicle can go to low or zero emission vehicles. We're not there on semis yet for our needs, but we're things like, courier services, couriering our lab specimens across the system. For example, we have gone to electric vehicles as our main priority. They are essentially moving specimens back and forth across our hospitals, our doctor's offices, nearly 24/7 for those. And so we're ensuring that those are all electric vehicles. For example, you might have seen some around Central Ohio already. And we're also working with our partners to ensure that they're doing the same. Because again, it can't be only Ohio Health and the hospitals doing this. We need to work with our partners to ensure that their actions and the way that they are doing the work on behalf of our hospitals is reflective of our priorities as well. So for example, you might have seen maybe some of the articles or the vehicles around Central Ohio with our partnership with MedSpeed. MedSpeed's one of our partner couriers, and they have, we've studied this with them. They are going to all electric vehicles for our fleet as well. So you should see some of those all electric vehicles going around. And because we had the infrastructure in place, we had invested in the charging stations, they're actually able to be like one of the first, I think, partners for MedSpeed across the entire country to go all electric because we had invested in the infrastructure that allows them to charge their vehicles at night at our administrative campus where we're only operating during the day. So that's definitely using our assets well. We're also looking at things like healthy buildings. So how are we building our buildings to be resilient for the future? So with our climate pledge to reduce our greenhouse gas emissions, we are looking at how are we decarbonizing the way we build. So can we prefabricate some of the pieces and parts of our hospitals, and that actually helps reduce emissions, and then bring them on site to the location of our hospitals. We're actually looking at concrete. How are we looking at concrete? How are we looking at where our building materials are coming from? Who is partnering with us to build those materials? How energy efficient is the HVAC? But we think about for future, you have to go all electric. And that is not easy for healthcare. Again, 24/7, very energy intensive. Lots of fans going because our operating rooms are 100% outdoor air intake. So how can that energy intensity allow for electrification with the limited space we have on our roofs? So it's also a competition between solar and electrification for the future. But we are studying that, maybe a hint for our newly announced builds. And then we're also looking at, from a healthy building perspective, the healthy materials that are in there, right? So ensuring that the supplies, the building materials, they're all don't contain chemicals of concern. And then looking at ways that we can ensure that when our patients come in to receive medical care, that they are also in a space that is healthy from the start, to allow for that true healthy and fair equal care for everyone. And I went like way over. I had like 1,000 other projects, but sorry, Noah.
No worries. It's great to hear about all that stuff. Certainly impressive work going on in both Lauren and Allegra's camps there. And while we've got some overlap, I've got a lot of great ideas from what they just shared. So certainly making note here. A few others for folks to consider, some projects that we have going on at Bon Secours Mercy Health. One is what we call channel optimization. So when we think about all those products coming in to our health system, there are lots of different supporting supply chains that they could follow. So in looking at that, if we can get more stuff on the same truck that's already coming our way, we can reduce a lot of the secondary emissions that might come if those products have to make it on their own through secondary channels. So a lot of effort being put into making sure we've optimized that channel. We've got that truck packed as full as we can with as much stuff as we can to reduce the emissions that might otherwise occur. We're also working, and we're grateful to the Ohio EPA on a project we're calling Grind to Energy, which is a solution that allows us to grind up through this huge, basically garbage disposal, a lot of the organic food waste, and pipe it in to a tank that holds a slurry that then can be used by some outside entities to produce energy. So a nice way for us to not waste and derive energy from it. We're exploring local manufacturing. The organization has invested in local manufacturing, and in collaboration with that manufacturer, talking about green practices in the production of those products. One of the challenges we all face, I think, is evaluating our Scope 3 emissions. It's just a large bucket. Many of us have our arms a little bit around Scope 1 and 2, but Scope 3 is kind of this big crazy maker. A lot of different complexities that make it difficult for us to fully understand, especially with large-scale hospital operations, all the different effects and emissions related to our Scope 3 space. So when we think about local manufacturing, obviously there's a little more visibility and capability in being able to address that. Additionally, local manufacturing is a way for us to reduce emissions. Products simply don't have to travel as far to get to where they're going to be used. And so if we have the chance to address the manufacturing processes, presence in that local manufacturing location, as well as reduce the distance and related emissions, we think we're going to be able to make an impact on the environment in a positive way through that. Also, we've started this year, we'll conclude this year, an inventory of our emissions. We want to make sure we fully understand how we're looking across all our locations. And of course, that's going to serve for us as a baseline a measuring stick to continue to reduce across our footprint for years to come. Additionally, we're exploring geothermal energy as we think about the ways to reduce our impact on the environment. We've found a few different projects active today, and some nearing completion, where we're going to use geothermal energy as a part of how we power our locations. So I'll kick it back over to you, Kevin.
Awesome. Well, thank you all for just the amazing work that you're all doing in the field. I know we have a little bit more time, and I think we have one more panel question, and then we're going to open it up for any audience questions that we might have. So I guess this final question for the panel: to understand areas to improve, it usually helps to gather data to develop that baseline. So how does your organization utilize data to understand each of your sustainability journeys? Lauren, I'm going to kick it over to you again. We'll just kind of go in that same order.
Yeah, you can't manage what you don't measure, right? So that is data has to be key here, and we're so lucky to have a partner in OHA that provides our Energy Star benchmarking for us. I mean, that's the easiest of the easy buttons. So that really helps us from an energy management perspective. But other ways that we do this is, we're a Practice Green Health member, which is a national organization. And they have an annual awards process that you submit thousands of data points, but you get a really useful gap analysis back to say, here's how you stack up against the 400 other hospitals that applied for this award. And then we do waste audits, thanks to a really wonderful Ohio EPA grant that we received. We were able to get some infrastructure, but also help us pay for a waste audit that helped us prioritize, clinical plastics. That's actually a huge recycling opportunity for us. And that's why we went down that path. So I think you have to be looking at that data. You also need someone who knows what it means. It's been amazing just having our senior energy engineer on for 3 months and what he's been able to do with the energy data, really distill it and bring some meaning to it. So I think it's having the tools in place to measure it. How do you act on that? And then how do you communicate that data? So Allegra, what else would you add? What else are you doing differently at Ohio Health?
Yeah, same as Lauren, agree with all of it. We're doing very similar things. I definitely think the OHA data has been really helpful for us because it helps us benchmark, not just internally within our system, but they actually provide energy data so we can compare ourselves against all other like-sized hospitals in Ohio, which is extremely helpful for our leadership to see. And then to Lauren's point, like just having the data there really helps us understand the priorities. So, we looked at landfill diversion work, lots of waste in hospitals. It's just inherent to what we do. But when we look at landfill diversion work, we're really looking at recycling. So we've also done clinical recycling within our operating rooms, but then understanding food, right? We're essentially 24/7 feeding thousands of people very different diets specific to their health needs. And so that just inherently creates waste. You can't predict if a patient is or is not going to eat their entire meal. And you have to have a lot of different ingredients on hand because of their different specific diet needs. So what we've done is, we actually started to measure our food waste. So we put in things like composting, food digesters. We do animal feed for our smaller rural hospitals. And then we even donate food at the end of the day. And then that showed us, we measured it, how much food waste we are producing. And that has actually influenced how we procure food, which is, number one goal, obviously, is to not have the waste in the first place. But then every single one of our hospital kitchens has food waste landfill diversion something in it, so that we are doing it at every single hospital across the system. And that's just something that also helps our associates feel connected to the work. So it's actually one of my favorite projects we've worked on. And again, food is health. So it's also another connection to that healthcare mission that we've really enjoyed working on.
Awesome, and I'll just share an addition there. Certainly the same plug for working with Practice Green Health and the OHA. You can't go wrong working with Kevin for sure. So you want to be able to, through those channels, I think, get an idea. Certainly has helped our organization as we participate in Practice Green Health's award application process. That's been a great opportunity across our organization for folks to consider this work and the data involved in connection with it, to collaborate across hospitals and even how they're evaluating and collecting that information. Gives them pause as they contemplate what they see after it's run through the the benchmarking that Practice Green Health does. That has been helpful for us as we contemplate strategic goals going forward, to evaluate areas where we're doing well and areas where we've got more opportunity. Also, when I mentioned earlier, we're doing this greenhouse gas emission inventory today. It helps us to understand where we stand in doing those activities, and making goals against emissions in particular. For us as well, we use energy just recently, actually, as our organizations come together. Recent past, we had a merger at end of 2018, came together as Bon Secours Mercy Health. And as that parent organization came together, we evaluated all the practices in connection with sustainability across it. And part of the shared platform, as part of that consideration was shared platforms, right? So we could see things across the system, operate with the same systems, et cetera. Recent past here, and for about 2 years now, we've had a shared platform for energy reporting. And that's been really helpful to see trends across the new organization and being able to address that. Likewise, I think was shared earlier, the Energy Star Portfolio Manager tool. That's been powerful for us as we've invested time in populating that to help our health system, especially our hospitals, to understand that energy utilization and how it stacks up in using that Energy Star standard. So all of these have been great, and we'd say some of the counties out there also have programs that you may look into and resources devoted to this work, that are willing to come and do audits of all different sorts, whether it's around your waste, your energy, et cetera, and in some cases have programs that can support you along that journey. So we've taken advantage of that. And one county I can think of, Hamilton County, down closer to Cincinnati. Back to you, Kevin.
Awesome, thank you all. And just kind of going off of those answers, I know, we've primarily focused on helping our hospital members and health systems capture their energy usage data. But our next step and our next vision is really looking at other areas that we can help capture data. One of those that I know we've all kind of mentioned is waste. And that is something we've been looking at. I know we have 2 pilot projects that all 3 of our panelists are participating in. So we have one here in Central Ohio that we've partnered with the Solid Waste Authority of Central Ohio, or SWACO, and then one in Hamilton County, which we've partnered with Hamilton County Resource. So again, great partnerships. We're kind of year 1, we focused on gathering this baseline data, understanding opportunities that exist at each of the facilities, identifying kind of what the need is for our waste streams out there. So we're kind of looking at, like everyone mentioned, hard to recycle plastics, food waste and organics, and kind of these bulk waste or donation almost items as well. With that, we were able to provide some waste audits through Hamilton County Resource, but then also funding opportunities for a variety of different pilot projects as well. So this is kind of some of the other things that we're just exploring at OHA for our membership as well, but things that our members have been able to take advantage of too. With that, I think we're going to turn it over to some audience questions, and we received a pretty good one here that I just want to ask the overall panel about. So I'm just going to read the overall question, and then you can kind of tackle it however you want to. So can you talk a bit about the challenges of integrating these sustainable solutions into day-to-day practices? Does leadership back your mission 100%? Do you have advocates outside of your office that push for change? And are there communication barriers between your office and others? I know a lot can be tackled there, so I will turn it over to whoever wants to start. I know we've been going with Lauren, but if anyone else wants to jump in to start, let me know.
I'll just quickly say, it's not easy. I will be very transparent. I kind of mentioned this. It's healthcare, right? We have a lot of priorities happening on a day-to-day basis, life impacting priorities. And what and I'm sure all of us push for on a day-to-day basis is second to patient care in that moment. So, if I want to switch to a more sustainable product, but it doesn't perform as well from a patient, performance safety perspective, we're not going to do it, right? It's priority number one is to do patient care. And so that does impact how easy it is to get things done in the organization. Every industry is different with sustainability. Healthcare is its own animal, but it's just to be honest, it's not easy doing this work. Lauren and I call each other on like a daily basis, just to, it's nice to not be, the only one tackling these problems. We do, like we've mentioned, work with others in the system, very passionate nurses. I just sat in on a new orientation for new physicians. So some of the younger generations are really pushing for this. I do think leadership, again, has a lot of priorities. They have signed on to this, so it's a lot, but it's definitely not easy. But I think it's becoming a big priority. As a patient, you are a consumer of our care. And so if you do enter our hospitals and you see opportunities and you think it does impact your decision making and where you go to receive care, it's something you can always submit in response to, how you thought your care was. And it's something that does get passed down from our leadership to someone like me at our hospital to make those changes. Styrofoam was the biggest complaint from our patients, and we now have no styrofoam. So it's definitely something that is heard when you do submit those. So selfish plug to please submit those just to help us.
Yeah, I'll just add, very much aligned with Allegra and what she mentioned. Absolutely do have leadership support, but again, lots of different priorities out there to grapple with. I'm sure all of us on the call here experience those as we go throughout our day. What's nice is that there has always been a consistent commitment to it. While there are times when we can do more and times when we can do less, the commitment to it has been unwavering. So it's just for us, I think, making sure we take advantage of the times when we have a more bandwidth and more capability amidst the external factors that might push against the prioritization. But for us, it's a consistent tenet of who we are. But knowing that from time to time we're gonna have to change things up. But there's always that consistent thread of commitment to be doing something.
And I'll just round us out with this question to say, yes, there are challenges of integrating this into our day-to-day practices for all the same reasons that both Noah and Allegra mentioned. A lot of the work we do is behind the scenes, right? Like, who knows if we're changing a sequence of a building to use less energy, or I'm helping to divert and donate unwanted supplies and equipment. It's not super visible. So I think part of the challenge is helping to communicate and teach our employees about what we are doing. But more so, we're just on the cusp of this. We do need to move more into a visible space, into the clinical space. And in that sense, one of the things we're working on is how do we get a medical director of sustainability who can really lead from a clinical perspective to help balance our patient care priorities and the first do no harm tenet, right? So how do we make decisions that do both? And so I think there's this clinical engagement that's coming, and then the green team that I mentioned is another way that we try and get this word out. And we're actually getting ready to start a subgroup in our green team called the Recycling Innovators. And so their role would be to almost be like a super user trained on all the different recycling streams and processes and help teach others what's going on so that they can be a little bit more connected to some of the behind the scenes work. You're only as good as the last training you did. And with the turnover in healthcare, or just the expansiveness, right? I'm one of 25,000 employees. So how do I reach everyone? It's complicated and it's challenging. But I think we're on the cusp of something pretty exciting and some big changes to come here soon. So thanks, Kevin.
Of course. Well, thank you all. This has been an amazing discussion. I'm honored to know you all and just participate in this panel with you all. So thank you all for the work that you're doing. Unfortunately, I think we are out of time. So Jessica, I'm going to turn it back over to you to kind of wrap things up. Again, thanks everyone.
Thank you so much, Kevin. And I would just like to reiterate what Kevin said. This has been a fabulous panel, and I wish we had more time to hear more from each of you. That was fabulous. And I just would like to thank all of our audience members for joining us today. We hope that you were able to learn a lot about the significant sustainability work underway at these facilities. And again, I wish we had more time to share more, but our speakers will follow up with any questions that were not able to be answered during this time. Before we end today, I just want to plug our Recycle Ohio grant program that will be starting soon. This program is Ohio EPA's yearly recycling grant that supports communities, nonprofits, businesses, and schools to initiate or expand recycling programs, encourage sustainable practices, stimulate economic growth, and support litter prevention efforts. Applications open on October 2nd, and you can find that application online at recycleohio.gov. I also would like to plug a couple of our upcoming sessions. We have one starting here in a bit on opportunities in energy development. We also have one at 1 p.m. where attendees will hear from local sustainability leaders on how to organize a zero waste event. And then our final session of this year's sustainability conference is Farming for a Sustainable Future, which will feature Ohio farmers talking about a variety of techniques used in sustainable agriculture. As a reminder, you will receive a survey slide when you leave this session. We do appreciate your feedback and would love it if you would take the opportunity to let us know how we've done today. And with that, I will go ahead and close us out. Thank you again for joining us today. We hope to see you later at some of our other sessions, and have a great day.